Did you know that around 30,000 people worldwide are diagnosed with mesothelioma each year? This rare but deadly cancer, mostly caused by asbestos exposure, has been a silent threat lurking in our walls, our ceilings, and even our communities. And while famous people like Steve McQueen tragically battled this disease in the past, today we're witnessing a wave of groundbreaking advances aimed at changing the story for patients afflicted by mesothelioma. New treatments are emerging, from immunotherapy breakthrough to CRISPR technology, promising precise genetic targeting. But there's more. Trend in personalized medicine and liquid biopsy are making it possible to detect the cancer earlier and treat it more effectively.
I'm Christina Bear. Welcome to today's Business Minute.
Emerging biotech hedge fund Evergrowth Biohealthcare Capital, we invest mainly in young growth biotech company that have their lead drug in the preclinical stage or early product stage because they have much more growth potential. There are new gene therapy being approved, gene editing drug, and then also innovative drug to treat obesity, to treat diabetes, to treat liver condition, and also many novel or new drugs to treat cancer. Now, by investing in companies that are at the forefront of such innovation, we support the cause that will continue to deliver the hope and new drug and new technology that ultimately improve the quality of life for the patient.
In our binary event forecasting strategy, we have a very high success rate, over 80% success rate. And by using that, we get able to position out properly and take advantage of those opportunities.
Within 6 months, we have an over 40% return. So in the coming year, there's a chance of even grow up to multiple year-fold in a very short time.
Today we have the honor of viewing our presentation from our chairman of the Medical and Scientific Advisory Board, Dr. Van Nguyen. He's a cardiologist and medical director of Baycare Medical Group. Today I'm going to share with you an overview of what Dr. Van discussed with members of our leadership team. Dr. Van first went into the definition of mesothelioma, which is a rare but very aggressive form of cancer that affects the tissue called the mesothelium. That is the lining or the covering of the internal body organ.
So as you can see in this cartoon here, we have mesothelioma affecting the different lining of the organs. And that can occur in the lining of the lungs, but also can occur in the lining of the chest wall, can also occur in the lining of the heart, and of course the lining of the abdominal cavity and its organ, including down below, we did not show this, but in cases that also involve the testes as well.
Dr. Van then discussed the cause of mesothelioma, which is due to asbestos fiber. It's causing inflammation of this mesocell lining the mesothelium, and then with the inflammation over time it causes mutation, and the genetic mutation in these cells would lead to cancer. You often hear commercial from watching late night TV. You hear commercial from lawyer asking for if you're exposed to asbestos, and then for that they'll compile the data for a class action suit against the company that provide the exposure to asbestos for patients who are afflicted by mesothelioma. Dr. Van then discussed about the quick facts of this disease. For the US, there are 3,000 new cases each year, but on a global or worldwide scale, the figure is much larger than that. 75% of this disease, as Dr. Van said, occur in males or men. Now, this cancer is very slow to form. It takes 10 to 50 years after exposure of asbestos to cause cancer.
Quick facts here. Annually, we have about 3,000 new cases in the United States. Around the world, the cases are increasing exponentially because of asbestosis exposure in third world country. As you see here, 75% of the patients being involved are usually males. Symptoms may take 10 to 50 years to manifest after exposure. Average life expectancy with treatment is 12 to 24 months. Pleural mesothelioma is most common, and this is what we probably see most commonly on TV ad in the United States, where the attorneys are advertising to call them if you have a history of asbestos exposure.
Dr. Van then discussed about the different staging, with stage 1 being the cancer localized to the pleural tissue, and that is of the lung, and then you have stage 2, 3, 4, which Dr. Van explained in the presentation.
When we stage a mesothelioma, we describe the stage as follows. Stage 1 involved the localized pleural, localized to the lungs only. But if it starts to involve the chest cavity, meaning spread to the chest cavity next to the lung pleural, then it becomes stage 2. And it can also involve the diaphragm, then it's also stage 2. But if it's spread to the chest wall cavity, as I mentioned, the diaphragm, then we can also look at other organs and result in stage 2 to 3. However, if you have spread to distant sites, meaning it has spread to other organs such as the liver, such as the kidneys, and including the heart, then that is significantly at stage 4.
Cause for this condition, Dr. Van went over asbestos. A sign and symptom of this disease, this cancer, mesothelioma, is very non-specific. The patient would experience cough, shortness of breath, chest pain, abdominal discomfort, fatigue, and also weight loss. And as you can see, those symptoms are very non-specific. Other patients who are afflicted by other cancer can also show that similar symptom as well. Now, for sign on physical exam or detection through imaging, the patient can have fluid build up in the pleural cavity, as well as in area where the tumor would build up.
The signs when you will see the physician, we would be picking up evidence of fluid buildup on exam or on imaging. We also can feel the tumor masses on the body cavity, and we also detect any kind of lumps or masses on exam as well.
Now, Dr. Van discussed the different type of mesothelioma, and they include pleural, peritoneal, pericardial, even testicular. So if the cancer grows in the mesothelium or the covering of the testes, then the cancer in this situation would be described or classified as testicular mesothelioma.
As you can see here, the types of mesothelioma can occur in the pleural, which is the lining of the lungs, but also can occur in the peritoneal cavity, which is the lining of the abdominal area. And then you have those symptoms accordingly. We also see this affect the pericardium, which is the lining of the heart. And then you have involvement as far down as the testes as well.
Diagnosis for mesothelioma, as Dr. Van shared, is include the imaging like chest X-ray, CT scan to get the diagnosis. Also biopsy of the tissue to run a test to confirm the diagnosis.
Diagnosis, we usually see this initially by chest X-ray or CAT scan. We would make diagnosis by doing procedures such as thoracoscopy, laparoscopically, and then get tissue biopsy to make the definitive diagnosis. We also try to work right now in using blood tests to identify specific asbestosis, create antibody reaction to allow our body to have antibody against it. And then we try to detect that specific antibodies.
For treatment, the mainstay treatment for mesothelioma is surgery, but oftentimes when the cancer is too big, we have to shrink it down with chemo radiation therapy to reduce the tumor size so that it's operable.
Treatment, usually the best, if we can get it early, is localized by having removal. But unfortunately, majority of patients, almost 80% of patients, get late diagnosis, and the only treatment available would be radiation to shrink down the tumor size, and then use chemotherapy or immunotherapy to help in killing the cancer cells.
Next, Dr. Van discussed about the emerging medical technology, emerging medical trend in this area to gene therapy, personalized medicine, CRISPR technology to allow us to cut out the genetic mutation in these cells, and also liquid biopsy or a simple blood test that can help in the diagnosis of this condition.
The emerging medical technology in our world hopefully will allow us to identify this condition earlier using the detection of antibodies, using liquid biopsies for non-invasive diagnosis, but we also have new CRISPR technology to allow us to go into the body and splice the mutation off to prevent further growth of the cancer cell. That would be the ultimate goal.
For treatment-wise, for other treatment, Dr. Van also discussed other treatment like bronchodilator, oxygen therapy, vaccination for patients afflicted by this cancer because the immune system is being suppressed by the cancer itself, chemotherapy, Alimta, so on and so forth, and then immune checkpoint inhibitor like Keytruda.
Medical treatment we have right now, including just symptomatic treatments such as bronchodilators, oxygen therapy, vaccination because patient would be immunocompromised, so vaccination would be helpful in prevent them from getting infection. And then we have chemotherapy agents such as Alimta, and then platinum, and then paraplatin. Those chemotherapy agents are fairly old agents, and they may be designed to kill the cancer cells.
And then last part of the presentation, we discussed about a potential area of investment, and we believe that an ideal investment would be a young growth biotech stock that are making gene therapy for this condition or a novel immunotherapy for this condition. Another prospective investment that would be lucrative would be for a small growth biotech stock that already has one FDA approval cancer drug, a novel form of immunotherapy for one cancer indication, let's say lung cancer, but now they're expanding it to treat mesothelioma as well, so that way they can enjoy the leaping in cells growth. That concludes my presentation. I look forward to seeing you the following week. If you want to capture this lucrative opportunity while investing in the innovation that deliver hope to the patient, but you either don't have time or you don't have the expertise, reach out to us, contact us. We'll schedule a call to see if we are the right fit for each other.